The next senator is Senator Ahmedvar.
Thank you, Chair. Thank you all for being here. My question is for Dr. Campbell. Dr. Campbell, you have recommended that the age of access for legal cannabis use be lifted from the currently proposed 18 to 25 years old. And yet we know that it is the age cohort of 18 to 25 who are the most significant users. I'd like you to comment on the health and social harms related to the ongoing, and I would imagine continued access to the illicit market by the people in this age cohort. So on the one hand, if age is set at 18 or 19 or whatever, they would have access to regulated products that are labeled for content that describe the risks, etc., associated with the product, as opposed to going to the illicit market. You're a family physician, so please comment on the health and social harms of ongoing access to the illicit market by this age cohort.
Absolutely, and that's a great point. So research shows that in Canada, the average use of initiation is 17 years old. 15% of people who we see with schizophrenia and psychosis is cannabis-induced, and most of this is from cannabis-induced in adolescence. You're at higher risk of this happening before age 25, specifically before age 21. There's been documented white matter changes in the brain, vascular changes in the brain, imaging on MRIs that shows irreversible damage that comes from repeated cannabis use. People who are young are vulnerable, they're impressionable, and they're more likely to develop habits such as cannabis use disorder, which can affect them lifelong. Once you develop certain illnesses, sometimes you can go back to the pre-morbid brain, but oftentimes you can't, and for these people it's very tragic. So
You still got time.
Thank you, Doctor. Would you comment on the social harms of criminalization of people who are not able to legally access cannabis as per your recommendation, age 25?
Yes. So regarding criminalization, I believe that decriminalization is important. I think that from my understanding, it's a bit out of proportion, the punishments for criminalization currently, the way the bill is now. I don't think that anyone should be criminalized for having small amounts of marijuana on them, but I think that there should be kind of this public image where every young person is really aware of the harms, like tobacco has done in Canada, and is educated, and especially when it comes to driving. There's research that shows in Colorado that traffic-related marijuana deaths increased 34% from 2013 to 2014. So that's another thing too. And
Still got the floor. Still got the floor.
I've still got the floor. Thank you. I want to ask my neighbors from Toronto to weigh in on the social harms of ongoing use of the illicit black market, especially as it comes to racialized youth. I live in a city, you live in a city where young black people are incarcerated at 3 times the rate of other users who also use cannabis. Could you describe the social harms that they are currently experiencing?
Absolutely. As you mentioned, there's a disproportionate number of racialized people who have been burdened with criminal records because of simple possession of cannabis. And one of the important things with including youth, providing them with legal access, is also they would be more open to accessing treatment. We could provide services and also have that education and conversation and engage youth in terms of harm reduction or prevention services that we provide. Moreover, at the local level, we're engaged with youth already, and to have a much more open conversation and for them to speak freely of their use, it provides the legalization starting from age 18 or 19 provides that opportunity. It also, one of the things about moving forward of talking to youth about cannabis is we're able to access them, get their attention on other substances as well. So in terms of, it's not just cannabis, tobacco, alcohol, and other drugs have to be addressed in concert with cannabis. And I know there's been research that cannabis is found in people who've been found impaired driving, but much of the research also shows there have been other substances along with cannabis. So again, there needs to be more research in that area. What are the co-effects of multiple substances, and also engaging this group, the more risk-taking group between the ages of 18 and 25, and including them is probably one of the most important things to do at this time.
Okay, thank you very